The amendment in the nature of a substitute makes primarily technical and conforming changes. It also adds the Department of Veterans Affairs to the outreach and education provision and modifies the expedited withdrawal process to incorporate input from the American Psychological Association. I urge all members to support the amendment. I yield back the balance of my time. Are there any amendments to the amendment in the nature of a substitute? For what purpose does Ms. Jayapal seek recognition?
Mr. Chairman, I move to strike the last word.
Gentlelady is recognized.
Mr. Chairman, I'm very proud that we're marking up my bipartisan bill with Representative John Curtis from Utah today, the Preventing Suicide Through Voluntary Firearm Purchase Delay Act. Today we face a dire mental health emergency of death by suicide. In 2021, 26,000 Americans committed suicide using a gun. That's 72 lives per day that were lost to suicide with a firearm. My bill would create a new tool that gives people experiencing the challenging swings of mental health illness to have the power to proactively and voluntarily protect themselves by putting themselves on a do not sell list for a firearm. Jack is one of the people who compelled me to address this issue. Jack is a PhD student at the University of California, Los Angeles, who wrote to me, "I have tasted the barrel of a gun before." Jack described his mental health crises that led him to being within seconds of pulling the trigger multiple times. Had he pulled the trigger, Jack would almost certainly not be alive today, because firearms are by far the most lethal means of suicide. 90% of attempted suicides with guns result in death, whereas other lethal means are fatal in only 4% of attempts. Suicides account for 56% of all gun deaths in the United States. So decreasing gun suicides can make huge progress in lowering the number of Americans we lose each year to gun deaths. Another incredible advocate that I met shared the story of her mother, Donna, who struggled with bipolar disorder. Donna and her family fought hard to get her treatment and protect her from harming herself. Unfortunately, they didn't have all the tools that they needed. And one day, Donna abruptly purchased a gun and killed herself. Donna's daughter, Katrina, believes that if my bill were enacted into law, it would have saved her mother. And Jack believes that this bill will exponentially increase his ability to live. This bill creates a bipartisan, proven mechanism to save lives like Jack's. It creates a novel way for individuals to voluntarily enroll in a firearm purchase delay database that temporarily prevents their ability to buy a firearm. Once enrolled, if a person experiences a mental health crisis and attempts to buy a firearm, they will be unable to. And in cases where an individual tries to purchase a gun to attempt suicide, this will be life-saving. In a University of Alabama study conducted by Professor Frederick Vars, researchers found that 46% of patients at high risk of suicide at the medical center would enroll in this system if available. Based on that data, this bill could save over 12,000 American lives per year. The bill is completely voluntary. Individuals cannot be enrolled by anyone other than themselves, and enrollment in the database is confidential, and information on enrollees cannot be used for any purpose other than to determine firearm purchasing eligibility, with very strict penalties for misuse and unapproved access of information. And if someone wants to remove themselves from the database, they can do so with no limits on the number of times they enroll and disenroll. It is modeled after similar bills that have already passed in my home state of Washington and in Utah with broad bipartisan support. Broad bipartisan support. In Utah, 2 Republican state legislators championed the bill, and support spans from mental health groups to gun rights groups. When the Utah bill passed, the chairman of the Utah Sports Shooting Council said, quote, "We support this legislation at the Utah Shooting Sports Council because it is completely voluntary, self-revocable, private, and confidential." So as we discuss this bill today, I urge my colleagues to think about what this bill will mean to the people facing mental health crises, whose lives could be saved, and what this bill means to their loved ones. I have seen firsthand the trauma that suicide causes, not only for the one whose life is lost, but for all the loved ones who remain. My husband lost his father to suicide when Steve was just 6 years old. We need more tools to help those who are fighting mental health illness. And let me be clear, this is a suicide prevention bill, one that has been used in red states and blue states to save lives. I want to thank the families and individuals who have shared what this bill means for them, including some of my own constituents who have lost family members to gun suicides. Matt and Cara. And I also want to thank Professor Vars, who was essential to drafting this bill. For these families and so many more that need tools to prevent suicides, I urge my colleagues to vote yes. I yield back.
Gentlelady yields back. For what purpose does the gentleman from Kentucky seek recognition?
I move to strike the last word.
Gentleman is recognized.
This is one of those pieces of legislation that sounds good and it feels good, but it doesn't work, and it opens Pandora's box. I think it's a wild exaggeration to say it would save 12,000 American lives per year. That assumes the person doesn't already own a gun or that a relative doesn't have a gun. And it also leaves out a very unfortunate phenomenon that I'm aware of because I have a friend who owns a gun store. People who want to commit suicide don't need to buy the gun. They can go rent it. There are ranges where you can rent a firearm, and you don't have to purchase it. Now, this has happened at gun ranges, and it would happen with more frequency, I would expect, if somebody puts themselves on a database, which I don't think that's going to work either, but it just happens, and you're ignoring that this bill doesn't address that, can't address that. One of the things, my biggest concern isn't just that the bill doesn't work, isn't going to work, and doesn't understand how these suicides occur. It's that it's ripe for abuse. I see here in the bill there's a provision where you can add your name by mail or by electronic mail. If somebody wants to dox you, I mean, this is a fairly recent phenomenon of the internet age, but you upset some folks on the internet, and they will go to great lengths to get you fired, to get you in trouble. I can imagine that they would attempt to submit your name by mail, steal your identity, and thereby deprive you of your Second Amendment right to keep and bear arms. And if they can intercept the communication that comes back the other way to confirm that you've been added to this list, you won't even know that you're on the list. So that's a big concern of mine. It also says that you can do this by mail if there's a letter accompanied by a mental health professional. What I'm concerned about is this creates a database. This opens the door, and write this down, mark it down, come back in 10 years and see if they haven't tried this, to allow this very system that this bill would set up to be accessed not by individuals with a letter from a mental health professional, but simply with a letter from a mental health professional. This is going to be ripe for expansion to do that, and I'm afraid this is one of those predictions that unfortunately is going to come true, that they're going to expand this later, and it's not just going to be the individual that submits their name. And I know there's a provision in here that says you can't be required to submit your name as condition of employment or to receive any benefit or service, but that's going to happen. It happens today at the Veterans Administration. I've had whistleblowers who work for the Veterans Administration tell me that what happens is when a veteran goes from like 50% disability and they apply for about maybe 85 or 90% disability, there's an interview that happens, and a doctor asks, or somebody at the VA asks, do you handle your own finances? And if you are unfortunate enough to say that you don't handle your own finances, and for some of these cases, people are thinking, well, my wife has the checkbook. I've never even written a check, so I don't. Mr. Tiffany would associate with that remark. I would too. I don't really manage my own finances. So if you say that, here's what happens. They add you into this Brady criteria. You get put in the NICS database. You become federally prohibited from owning a firearm. There's no adjudication. There's the opportunity for adjudication, but here's how it happens. In the same envelope that the VA sends you that says, we approved your benefits, there's another letter that says, by the way, unless you appeal, you're going into the NICS background check system. No veteran who depends on that benefit to stay in their home, to buy their food, is going to appeal that when it comes in the same envelope. So that's another grave concern I have about this legislation, is that there will be the implied condition that you submit your name before you receive something from somebody else. And it may be a family member. It could be a family member who just says, look, I'd like to give you this or get you that, but you're going to have to put your name in this database. And so it's for that and other reasons I oppose this bill, and I will have some amendments on this bill, and I yield back.
Gentleman yields back for our purposes. Gentleman from Rhode Island, seek recognition.
Mr. Chairman, I move to strike the last word.
Gentleman is recognized.
Thank you, Chairman Nadler, for bringing this suicide prevention bill to markup today. We have a mental health crisis in this country, and we're losing far too many Americans to suicide. And half of these suicides are committed with a firearm, leading to 24,000 deaths each year. The odds of a suicide attempt ending in death are 140 times higher when a gun is involved. A 2020 Stanford Medical School study found that men who own a gun are 8 times more likely to die of a gun-related suicide than those who don't have a firearm. With women, they are